Together we achieve victory over heart failure.
Hello, I'm Dr. Anuja Mulay. I'm a cardiologist practicing in the city of Pune. Today, we are going to talk about a silent epidemic which our country is combating, which is heart failure. So, in our country, that is in India, a majority of our patients have heart failure, and a lot of them is the younger population. In the Western world, we see that predominantly heart failure is a disease of the elderly. But in contrary to that, in India, it is very common to witness young adults seeking medical assistance for heart failure. So we see a lot of myocardial infarctions, which is heart failure, heart attacks in our country, and which leads eventually to heart failure. So let's break down a few things that we need to know on heart failure. There are a lot of myths associated with heart failure. So let's see what we need to know really when someone tells us that we have heart failure. So first of all, when someone tells us or when a doctor tells us that you are diagnosed with heart failure, it does not mean that your heart has stopped functioning. It is not the end of life. Basically, it can seem frightening, but basically it means that your heart is struggling to pump blood as efficiently as it should. If you undergo an echocardiogram or a color Doppler, there is a number written in it, which is the ejection fraction or the EF. This measures how well your heart is pumping out blood. So it is the amount of blood which is pumped out into your circulation from the heart's ventricle, which is the left ventricle, which is the major contracting chamber. So a normal ejection fraction or EF is about 50 to 70%. And when it is reduced to a lower limit or a lower number, individuals are diagnosed with heart failure. So first of all, a low ejection fraction is what is meant by heart failure and not the heart stopping to function. So this is a very scary term. When someone says heart failure, we always think that now it is over. But no, heart failure can be controlled very well with medications and it is not the end of life. A normal or a near normal lifestyle can be achieved even in patients with low ejection fraction. Now, the second most important question is, why are so many Indians being affected? So as I just said, that blood pressure, diabetes, obesity, smoking are very rampant in our country. The incidence of diabetes is increasing. The incidence of young patients getting heart attacks is increasing. Genetics also plays a significant role, and Indians are more susceptible to have complex cardiovascular disease and thus leading to heart failure. And hence, in India, we are seeing an increasing number of heart failure. So moving on, how do you know that a person has heart failure? So there are a lot of symptoms associated with heart failure, out of which some of the common ones are breathlessness, which is scientifically known as dyspnea, or getting tired easily, nausea, low appetite, generalized weakness, fatigue, sometimes even confusion, swelling over the feet, a reduced urine output. All these are various signs and symptoms of heart failure for which a person needs to seek medical attention. Now, how can you prevent ourselves? How can you prevent yourselves from getting this disease? So, our heart is a machine, it's a pump after all, and it is working continuously without rest to keep us alive. So, certain measures which are going to protect the heart are obviously going to prevent heart failure. So, regular blood tests, regular echocardiograms or stress tests when it is necessary in patients who are at high risk, especially diabetic patients, is essential. Once such an event has occurred, a regular follow-up is recommended. There will be a lot of medications on which the patient is put on, which need to be taken regularly. Regular visits to the doctor, adjustment in the diet, incorporating daily exercise, which has to be compulsory into your routine. Now, this exercise will be different for each and every patient. So whatever your heart can tolerate and how much ever your heart can tolerate, your doctor will prescribe that much exercise, and that needs to be done regularly, which is important for the conditioning of your heart. Also, it helps in controlling blood pressure and diabetes. So the risk factors which are going to contribute to heart failure are also kept in check. Most importantly, some stress management techniques could be practiced. Also, quitting alcohol, tobacco, and smoking are very important because they are the most important risk factors. Also, keeping your diabetes and blood pressure in control have a lot of significance. So once you're diagnosed with heart failure, what comes next? So thankfully, there is plenty of medication available currently for heart failure. There are lots of drugs which are available, which will keep your heart functioning well, if not normal, but it will support your heart. It will reduce the symptoms. It will prevent hospitalizations. There are a lot of drugs which are present, like beta blockers, diuretics, and a lot of other medications. So it is definitely possible to lead a normal and productive life. These medicines definitely improve quality of life. They also improve longevity and they have hardly any side effects. Certain things like blood tests and an echocardiogram will be regularly monitored when there is heart failure and when you are on these medications, but it can definitely lead to a normal life. There are also devices like a biventricular pacemaker, which is known as cardiac resynchronization therapy. There is also an implantable cardiovert defibrillator, which is required in some patients. If there is an abnormality with the heart valves, there can be a repair or a replacement for those valves. So that will remove the cause of the heart failure and hence improve symptoms. Also, now in India, a rapidly emerging technology, which is heart transplant, is also being practiced, and hence it will help us in the treatment of heart failure. If you look at the lifetime risk of heart failure, it is going to be about 1 in 5 people have heart failure in the coming 10 to 20 years. So we should remember that awareness of heart failure, proactive measures, which we said, which would protect ourselves from this disease, and then regular treatment if required, are key in combating this silent epidemic. Thank you very much.